There is an unmet need. We know that we did pretty good stuff for the prevention of ischemic strokes, but for the prevention of cardiovascular events in patients after intracerebral hemorrhage, things are not going really well. So, in fact, we haven't changed the risk since the last 30 years. And part of it is because when you have a recent bleeding to the brain, you're in this very awkward position where you need to make some hard calls for your patient. So you have a patient with a recent bleed that they need to be on antithrombotics, and you cannot give antithrombotics at least for a little while because you're afraid of the risk of bleeding. Of course, this bleeding is also long-term, but especially in the first days and first months, it is pronounced. And in fact, we know from observational studies that physicians are very reluctant to introduce antithrombotics for patients that they have indication after an intracranial bleed because they're worried about the bleed, and that's very reasonable. So together with my colleague Askan Suomanes, we're thinking, after seeing the data from cardiology, that targeting inflammation can reduce the risk of major adverse cardiovascular events, that maybe if we target inflammation in patients with intracranial hemorrhage, we can find a backdoor where we can decrease the risk of cardiovascular events and at the same time do not increase the risk of bleeding. Having said that, we know that inflammation plays a big role in patients with intracerebral hemorrhage. We know that when you have a hematoma in the brain, you have an inflammatory cascade happening not only in the central nervous system, but also in the periphery. And we have more and more evidence coming from experimental studies and observational cohorts that increased inflammation is indeed associated with worse patient outcomes. So by targeting inflammation, we're aiming to reduce the risk of major cardiovascular events, but also to ameliorate the secondary inflammatory brain injury in patients. There are different therapeutic approaches targeting different parts of the inflammatory cascade. So we're doing a trial named COVASC, which stands for Colchicine for the prevention of cardiovascular events after an intracerebral hemorrhage. So it is a vanguard phase study. We have started in 10 centers in Canada, and we're hoping to expand to a full-scale phase 3 trial. So what we do in COVASC, we enroll patients after an intracerebral hemorrhage if they had the onset within 48 hours and they had some risk factors or evidence of atherosclerosis. So those patients, they get randomized to either colchicine, a low dose colchicine 0.5 milligrams once daily, which is the dose that was used in cardiology trials, or they get assigned to placebo. And those patients, they are followed for a mean duration of a year. So we're capturing their outcomes in terms of cardiovascular events. We are also capturing their cognitive changes over the course of the follow-up. And we also have an embedded MRI sub-study. We're doing an MRI for individuals that they can get an MRI within 7 to 13 days. And what we're trying to see in this MRI is if there is evidence that colchicine can have some effect on the CNS inflammation after a bleed. So we're looking at the perihematomal edema and also in the remote diffusion weighted imaging lesions that we see in many patients that they have a recent brain bleed.